Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, listeners. It's Lindsay Smith-Rogers. Today, confusion around COVID vaccines. Katelyn Jetelina of Your Local Epidemiologist returns to the podcast to talk with me about why this fall may be anything but typical when it comes to COVID vaccines and how this could be an indicator of other changes to come for routine vaccines. Let's listen. Katelyn Jetelina, thank you so much for joining us back on Public Health on Call. How are you doing?
Loaded question, Lindsay. Hanging in there this hour. Thank you for having me. Excited to be here.
All right. So you and I were trying to figure out what we're going to talk about for this episode. And there were so many well, this could happen and this could happen. And then I said, let's just press record and let's just get this out. So what we're talking about today is fall COVID and flu vaccines. Why don't you start with laying the scene of where we would normally be in the middle of August, like last year or something like that?
Yeah, so a lot of people don't know that our annual respiratory vaccine rollout happens behind the scenes, very kind of bureaucratic, but also usually very smooth and synchronized sequence. I like to imagine it as dominoes that are set up. And when the first domino falls, which is usually in February, the rest just usually follow in a very smooth and synchronized way. And then eventually we get shots in arms by fall. And so if this was like last year or the past, 20, 30 years. But what it would be right now in mid-August is we would have clear guidelines from CDC through this organization called ACIP on who should be getting the flu vaccine, who should be getting the RSV vaccine, as well as COVID. ACIP and CDC really determine eligibility and the policy for that. Right now in mid-August, all physicians would have ordered their vaccines already because that takes a couple weeks to get shipped. And the vaccine manufacturers are creating the vaccines on the line. So all of these players are kind of in motion. But like I wrote in my newsletter on Your Local Epidemiologist, this year is very different and leads to a lot of unanswered questions, even now in mid-August when people are already going back to school and clinics already need to be ordering vaccines.
Yeah, I think nurses and some other frontline health workers may get vaccines usually as soon as the first week of September.
That's right. So they typically put in their orders, health systems, pharmacies put in their vaccine orders in mid-July. So you're right. They get them by end of August. So people can start getting them in beginning of September. And like I said, it's kind of worked like clockwork for the past decades. And it's just very, very different this year, I guess, especially with COVID.
So let's talk specifically about COVID and where we are in the process. What was maybe the first domino to fall, or where are we now?
Yeah, so I don't know if the dominoes have fallen. They're kind of missing, or they're wobbling, or they're stalled. And the first wobbling domino that got me nervous was ACIP. Usually in June, ACIP votes on who should be recommended for COVID-19 vaccines, and that vote just didn't happen. And that has really big implications on if insurance is going to cover COVID-19 vaccines, how many vaccines physicians should order. So they're not on the hook of paying for vaccines that won't be used because they know the eligibility. So that was that was the first to wobble, and we probably won't get clarity on that one until mid-September.
And so what happened after? Well, I guess what didn't happen after that?
So because the ACIP didn't vote on the COVID-19 vaccines, that means that it sounds like a lot of physicians and health systems just haven't ordered COVID vaccines yet. They don't know how many to order. They have no idea who's going to be eligible. And so that was happening. What's also happened is that insurance hasn't really come out to say if they're going to have a no cost for COVID-19 vaccines because, again, they don't know who's supposed to be covered. And what's also, kind of caught up in all of this is like communications and vaccine campaigns. If we don't know who's going to be eligible, how can you start like working with communication strategies and Instagram posts and FAQs and all of these things? So I feel like everything's just kind of frozen in the moment right now. And the reason that's a problem is because fall respiratory season is just around the corner. And all of these pieces take time to get implemented and get into place so people, when they show up at a clinic or a pharmacy, can get the vaccine and are not turned away.
So is this unique to COVID vaccines? Where are we with flu shots, for example?
So it is unique to COVID-19 vaccines. I would say that RSV and flu are largely business as usual right now. So I really want people to hear clearly and confidently that yes, those vaccines are available. Yes, you should go get them. And yes, they will be at the pediatrician's office.
So there's a number of things that you're watching for. This ACIP vote, do we know when that might take place?
So they are going to do an emergency meeting, I guess, or off the schedule meeting mid-September for a COVID-19 vaccine vote. This agenda hasn't come out yet. The reason why that is challenging is because by mid-September, it's already like fall vaccine season. It's way too late for then physicians to order it and then it to get shipped and then for people to show up at the clinic. So yeah, mid-September is when the ACIP is supposed to meet again.
What else are you looking at right now?
There's a few other dominoes I'm looking at. One is the FDA vaccine license. So how they label this vaccine. And there are a ton of signs that the FDA is going to limit who is eligible for the vaccine. And this is very different than previous years where the label was for everyone over 6 months. And it sounds like they're going to restrict it to only high risk, which is probably those over 65 and those with a chronic condition. Now, what is a chronic condition? What is high risk? We don't know what those answers are. Like pregnancy, for example, is a big question mark. Two other things that I'm also waiting on is because of this wobbling dominoes and the confusing policy implications, what has happened is outside groups are starting to come together and look at the evidence as well, including the Vaccine Integrity Project. They have put together a review of evidence and will be presenting that kind of outside of the federal government to fill these gaps of third-party validation, honestly, after the last ACIP meeting. And that meeting will be coming shortly. It'll be very interesting to see how that comes out and what the evidence says around COVID vaccines and who should be getting them. Another thing that's happening is that professional organizations, so we're talking AAP, American Association of Pediatrics, AMA, ACOG, are also going to make their own recommendations outside of the federal government. And so there's kind of like the federal track we're seeing, as well as this construction of another track to fill the gaps of the federal government. And I really think it's going to be quite confusing these upcoming weeks.
Now, these other tracks, can that influence things like whether pharmacies place orders or whether anyone can go get a COVID vaccine if they want one?
Well, so this is the billion-dollar question, Lindsay. And I think it's like literally the billion-dollar question is how are the insurers going to play their cards? So if insurers are like, yes, we're still going to cover vaccines regardless of what ACIP says or the federal government, because the professional organizations say that everyone needs to have it, that kind of opens the doors, right? Because people will more likely be able to get the vaccine. They can afford it. It won't, it'll be free. Nothing will change. So a lot determines on what insurance is going to say. Now, the question is, what track will insurance default to, right? The federal government or this other track of professional organizations? And that's a big unanswered question we have right now. And I really think it's whoever's first, right? Is the FDA label change going to be first, or is this Vaccine Integrity Project outside organization going to be first? And I think that game of politics is really important for insurance companies.
Why is this happening?
Well, we have a health secretary, Kennedy, who deeply believes that this system is broken and that he needs it fixed. It's deeply baked in ideology. And I think it's incredibly dangerous. I distinctly remember at the confirmation hearing in front of Congress, Kennedy said, "I'm not taking anyone's vaccines away." And I guess it's true, right? Like, they're not actually going to be stopping manufacturers from making this, but access is huge to how people get vaccines. Behavior is huge. Falsehoods and rumors impact behavior. And I think this is an incredibly dangerous thing to do. And one thing that is on a lot of our minds in the health policy world is this just the practice run for routine vaccinations? And I'm worried that that is the case. And if that's the case, then even more important that professional organizations and insurers and physicians and pharmacists and everyone gets together with a united front and with clarity and with coordination, because the system can still protect millions out there if it wants to. It's not going to be business as usual, but we can rebuild it. It's a matter of if we will and the will to. And I think that's the biggest unanswered question we have right now.
So in other words, sort of wobbling of the process of COVID vaccines, the delaying, the uncertainty, your concern is that this may impact vaccines like measles or HIV, ones that are given routinely to infants, things like that?
That's right. I think that the outcome of this effort is going to be consequential because, like I said, I think it's a test run for what's to come. RFK Jr. has signaled interest in reevaluating other routine vaccinations like HPV and hepatitis B and measles. And so you can imagine a world where ACIP under RFK says, we don't recommend HPV vaccine anymore. Then what are insurers going to do? How are physicians going to order them if they're not covered? How are people going to access them if they can't go to the pharmacy, right? So we're still going to have all of these same questions, just not for COVID, but for other vaccines. And that's not guaranteed. We still don't know, but that is a signal that I am paying very close attention to.
Last question for you. Aside from your local epidemiologist, aside from Public Health on Call, where can people go to find information about vaccines?
I will tell you, immunize.org is an incredible resource with vaccines. American Academy of Pediatrics is on top of all of this. I think they're doing an incredible communication job and have really been at the forefront of this. Healthychildren.org, which is under AAP, is also a fantastic resource just for parents like me. When I just have this random question, I don't know where to go to. I do trust healthychildren.org a lot. And so I would definitely keep track of what they're saying and hope it brings clarity for everyone. And like you said, I'll be tracking this in Wiley, trying to do it as best as I can, but it is a really confusing time. And I empathize with anyone that's just trying to understand what the heck is going on right now.
Katelyn Jetelina, thank you so much for being on Public Health on Call.
Thank you for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.